Good day, everyone. This is John Lalmoni from Bibliobazar. Welcome to today's presentation, where we will be discussing osteomyelitis, an overview of bone infection. This session will cover the disease condition, its causes, signs and symptoms, methods of diagnosis, treatment strategies, and nursing management to provide a holistic understanding of osteomyelitis. Osteomyelitis is an infection of the bone that can occur due to the spread of bacteria or fungi through the bloodstream, from nearby infected tissue, or directly through wounds, especially after trauma or surgery. It is a serious condition that can lead to bone destruction if not promptly diagnosed and treated. The most positive organism is Staphylococcus aureus, although other bacteria and fungi may also be involved depending on the patient's health status and mode of infection. Causes of osteomyelitis include open fractures, surgical procedures, diabetic foot ulcers, pressure sores, and bloodstream infections. Factors include poor immunity, uncontrolled diabetes, peripheral vascular disease, intravenous drug use, and recent orthopedic surgeries or implants. Children are often affected through hematogenous spread, whereas adults may develop osteomyelitis secondary to trauma or adjacent soft tissue infections. Signs and symptoms of osteomyelitis may vary depending on the severity and duration of the infection. Common features include localized bone pain, tenderness, swelling, redness, warmth over the affected area, fever, chills, and general malaise. In chronic, there may be draining sinuses or the formation of abscesses, with systemic signs being less prominent. Diagnosis of osteomyelitis involves a combination of clinical assessment, imaging studies, and laboratory tests. Blood tests may reveal elevated white blood cell counts, C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. Imaging techniques such as X-rays, MRI, and CT scans help visualize bone changes and abscess formation. Bone biopsy and culture are definitive for identifying the organism and determining appropriate antimicrobial therapy. Treatment of osteomyelitis includes long-term antibiotic therapy, usually administered intravenously for several weeks. In some cases, especially in chronic responsive infections, surgical debridement of necrotic and surrounding tissues is necessary. Treatment plan depends on the severity, location, and type of infection, as well as the patient's overall health. Nursing plays a crucial role in the recovery from osteomyelitis. Nurses are responsible for administering antibiotics as prescribed, monitoring for adverse effects, and assessing the patient's response to therapy. Wound care is essential, particularly if surgical intervention has taken place. Nurses also provide education on the importance of completing the full course of antibiotics, maintaining good hygiene, and managing underlying conditions like diabetes. Monitoring for sepsis, maintaining proper nutrition, and mobility while avoiding strain on the affected limb are all part of comprehensive nursing care. Thank you for joining today's session. Subscribe to our channel for more informative videos and visit bazarbiblio.com for notes and free PDF books. Thank you.